The Dartmouth-Hitchcock Heart and Vascular Center provides state-of-the-art services in clinical cardiology, advancing frontiers of knowledge in cardiovascular medicine and training the next generation of heart and vascular experts. February is Heart Month, and Dartmouth-Hitchcock wants you to know about your heart health. This is the second in a series of podcasts called Get Heart Smart. Dr. Bruce Andrus, co-director of the Pulmonary Hypertension Clinic and Lipid Clinic, and associate professor at Dartmouth's Geisel School of Medicine, is here with us today to discuss heart health, preventive cardiology, and to provide some Get Heart Smart tips. Dr. Andrus, thank you for joining us today.
It's my pleasure to be here.
You have several areas of focus, including preventive cardiology and pulmonary hypertension. Today, let's focus on heart health and preventive cardiology. Can you describe what preventive cardiology means?
Sure, I'd be happy to. It means trying to treat people before they have manifest disease, before they've had a heart attack, or before they've developed congestive heart failure. And it generally focuses on minimizing or eliminating risk factors that lead to heart disease. Over the last 50 years or so, we've reached a much better understanding of what the specific causes of heart and vascular disease are, and those risk factors include many factors that we're all familiar with, including smoking, high blood pressure, diabetes, obesity, sedentary lifestyle, poor diet, as well as some genetic conditions that affect a person's cholesterol profile. Preventive cardiology has 3 levels. The first level is primordial prevention, and that is minimizing the risk factors within our communities and within our society. And examples of this would include legislation to prevent young people from starting smoking. It includes promotion of healthy meals and appropriate portion size in restaurants, and it would include things such as sidewalks to make it easier for people to get regular physical activity. It also includes things such as minimizing the size of soft drinks and the availability of processed food that's available to children, and the availability of healthy meals through schools. So that's primordial prevention. The next level is primary prevention, and that is pursued at an individual patient level, and it's focused on preventing the development of cardiovascular disease. And that includes control of blood pressure, control of cholesterol, control of blood sugar, smoking cessation, regular exercise on an individual basis.
How does nutrition play a role in preventative cardiology treatments?
I think nutrition has the potential to be an important and powerful influence on someone's health, but it's also one of those issues that's very hard to change because we develop preferences and food preferences and habits early in life, but nutrition can play a role in all aspects of cardiology treatments. It has a role in managing high blood pressure, in minimizing the risk of heart attack, and in treating heart failure. Before getting into the macronutrient balance of a diet, the first step is just making sure that the caloric balance is appropriate. So many of us should ideally lose some weight to achieve an ideal healthy weight, and so the first step is just getting the number of calories correct, and that's not easy. That's step one. The next step is to consume follow a dietary pattern that's going to minimize inflammation in the vascular system, that's going to promote a healthy lipid profile, healthy cholesterol levels, and a diet that's going to help minimize hypertension and minimize sodium retention and water retention. So those are some of the ways that nutrition can affect the treatment for cardiovascular disease.
So can you talk to us about how we can reduce the need for surgery?
I think we can reduce the need for surgery by reducing the development of cardiovascular disease in the first place, and that starts with healthy habits really in childhood, where our habits are first formed. It means getting at least 30 minutes of physical activity every day. It means eating a number of calories that does not make us overweight or obese, monitoring our blood pressure and monitoring us for each other for the development of diabetes, and it means, above all else, not smoking.
Describe a lifestyle plan that would help a patient stay well and symptom-free.
I think that lifestyle plan would include getting 30 minutes of physical activity every day, and probably an hour would be better if you need to lose weight or have once been overweight. It would also include a nutritionally dense diet, which is rich in vegetables and fruit, lean meat, fish, and legumes, as well as a small amount of nuts, which contains very little, if any, processed foods or added sugars in the diet. That lifestyle pattern would also include being a lifelong non-smoker. It would include maintaining friendships and social connections that help us stay engaged and motivated. It would also include healthy means of coping with stress rather than unhealthy means of coping with stress, specifically limiting alcohol use to no more than 1 serving for a woman per day or no more than 2 servings for men per day.
What is the most important thing that young people can do to keep their heart healthy?
I think the single most important thing is to avoid the use of tobacco products.
How can we be heart healthy in such an inactive lifestyle? We sit at desks all day, and even if you exercise once a day, you can still develop heart disease. What advice can you provide?
I think it's a challenge, but I think it's possible if we use some imagination and creativity. Some things you can do are to pack your lunch at home, eat a sandwich in 5 or 10 minutes, and use the remaining 20 minutes of a half an hour lunch break to walk briskly or either within your work building if it's poor weather or walking outside.
Is it ever too late to improve your heart health?
Certainly not. No matter what your age, you will still benefit from quitting smoking if you're a smoker, from improving your eating habits, and from getting regular physical exercise.
Describe why high blood pressure is such a major risk factor for heart disease.
I think it's a major risk factor because of the stress it puts on the entire cardiovascular system. The heart, in essence, is a pump, and the higher the blood pressure, the greater the resistance against which the heart has to pump. The consequence of that is that the heart becomes abnormally thick, which is not a good thing. It also requires much more blood flow to meet that increased wall stress, and that increased blood flow through the coronaries is probably deleterious to the coronary arteries themselves. The high blood pressure also has adverse effects on the peripheral arteries, including the arteries that supply our brains with blood. So it can lead to premature disease in the walls of all of these blood vessels and increase our risk of stroke, heart attack, and heart failure.
Is there anything else you want the listeners to take away from our conversation today?
Most of the cardiovascular disease that afflicts our society is preventable. It's not easy, but it is preventable. And the steps to reduce the burden of heart disease in our community should focus on eliminating cigarette smoking, achieving a healthy weight, eating a nutritionally dense diet, and getting regular physical activity.
Dr. Andrus, thank you again for joining us today and providing heart-healthy tips and information on preventative cardiology and general heart health.
Thanks very much for having me, and I hope that listeners have found some of this helpful, and I look forward to seeing you out there on eating well and exercising on a regular basis.
For more information or to attend a Get Heart Smart event in your area, please visit d-h.org/heartsmart. Thanks for listening.